side of the toe, wobble wobble on the top, and then come down the side here. This is a chronic neck area. That's the brain, busy brain, coming down the side. Coming down the side. Now I'm going to walk across the face at here. We've got the trigeminal nerve and the teeth, and so you walk across here. I use all my fingers. You can use one at a time. I prefer to do it this way, and then down the front here. See my other hands being used as a platform. That's the way I prefer. It needs support. You can also do across these toes as well. Some consider this the face, so if you want to do some extra work, and it's easier just to use the one finger to go across here. Okay, now we're going to go down the spine, so you can see I'm supporting the foot from the top, tiny little bites coming down, coming all the way down there to the bottom. Because I'm on the right foot, which is actually on my left, I'm next going to do the ileocecal valve. That's on the corner of the heel line here. I'm going to push my thumb in and hook out. With the other foot, obviously you would do that V for the sigmoid colon. Right, now I'm dividing the foot up in my mind between the waistline and the diaphragm line, and I'm going to work that in a cross hatch movement. So from the waist to the diaphragm line, again tiny movements, working the upper abdomen. And then change hands to work from the lateral side. And now I'm going to work from the waistline to the heel line. Just put the foot under here, from the waistline down, just going straight across. All the way down. If it's a smaller foot, you're in luck. If it's a size 12, you just have to spend longer doing it. That's the way it is. So you're covering the whole bottom here. Right, I'm going to do the bladder reflex. The bladder is just underneath the ankle here and usually shows up as a puffy bit. And here we are. And I'm going to put my thumb on, rotate the foot onto my thumb, and then walk up to the kidney. Now the kidney is in the second zone and just on the waistline. So I'm going to roll the foot onto the kidney, swing up, hook into the adrenal gland and slide down. Do that 3 times. 1, 2, 3. I'll just do it twice because the other time looks exactly like this one. And then hook up and then come down. I'm going to now work this section where the uterus is, and I always start in the middle for no reason at all, other than I do. But as long as the main thing is that you're working, if you can see that V, I'm working out. You could think of it like a bunch of flowers if you like, or just a V shape. And 3 times you want to thoroughly do that area. We've got the we've got the womb, the uterus, and of course the prostate here for men. So you work that 3 times and then bring the foot over and do exactly the same in that section there. So it doesn't matter really where you start, but you're starting on the corner of the heel and then working up and covering that whole area. And you go over that area 3 times. So you could go back one way and then work your way back. Work your way back all the way to there, and then we're going to finish off. Thumbs at the base of the heel just for support. They're not doing anything, they're just supporting. And then really what you're doing is joining up ovaries and the uterus, because this is the fallopian tubes. Also in men it's the vas deferens. Just careful not to pinch the skin at the top. So you're walking across the top here, and then you've finished doing the reflexology treatment. But this is when you would then revisit the areas of congestion, any tenderness, and or sometimes people do the other foot and then revisit both areas. It really depends on the individual, how they want to work. So then I would cover that foot, and then I'm ready to do the other one.